Hey, what is up, everybody? Hope you guys are doing well. I'm Dr. Steve Schlintz here at Harmony Dental Health, and today I want to discuss a potential Invisalign case that we were working up in the office, and I have no idea if this patient is going to go through Invisalign therapy or not. Most likely she will, based on what we were discussing, but who knows. But regardless, I do want to talk about this case because I actually find it to be a very interesting case. Typically when we do clear aligner therapy, orthodontic movement, Invisalign, if you will, usually there's a lot of malalignment, and that's one of the main reasons that people do Invisalign. You know, I have crooked teeth, I want to get those teeth straightened. Sometimes in a case like this, that's actually not the case, but there's other things that are going on with the bite that make us think that Invisalign is a good therapy for her. The first thing you will probably pick up on if you are looking from an aesthetic standpoint for this patient's potential smile is that she has two baby teeth. She has a baby tooth right here and a baby tooth right there. Now those two baby teeth are creating issues for her because obviously when she smiles, those teeth look like they're missing because they're hidden by the adult teeth. So we talked about Invisalign, not Invisalign, we talked about veneers, we talked about cosmetic bonding. We're probably going to go through with cosmetic bonding. This is a younger patient. She can always get veneers later, but I like to start with cosmetic bonding if that's possible for the patient. So we're going to move into that direction. But what was interesting as we were talking about that again today, she said, you know, my bite just doesn't feel right. And I asked her, what does that mean to you? What does that mean that your bite doesn't feel right? And she started to describe to me exactly what I'm seeing on the scan. She said, I feel like my bottom teeth are leaning back so that I can get in contact with my upper teeth. That is 100% the case for this patient. She was very astute, very well aware of what was going on. And I said, you know, that's exactly what you're experiencing and feeling because that's what's there. So what I like to do is actually look at the alignment of the teeth and the arch form. So basically the arc of the teeth, or, you know, to make it very simple and something for you to remember, your teeth should be shaped kind of like a rainbow, right? So your top teeth will have a rainbow shape, your bottom teeth will have a rainbow shape. And ideally what would happen is your bottom teeth fit inside of your top teeth. That is what we would consider a better a bite for you. And there's some like dimensions in terms of how much overjet are you getting and overbite. And you know, the more ideal that is, the better you can function, the longer you keep your teeth. But for her, she doesn't have that. In fact, it almost looks like her lower teeth are actually in a wider arch than her upper teeth, but they've gotten artificially pushed back so that her lower teeth are behind her upper teeth in that ideal bite relationship. So what does that mean? What that means for her is she's starting to put a lot of stress on her lower front teeth. Okay, so let's look at the intensity of the bite on her lower front teeth. So I'm going to bring this up for us. Okay. Now, what you're going to notice on this scan is the easiest way to think about what I'm looking at. Let me see if I can do this. This is perfect. Okay. The intensity of the bite looks red, right? The more red, the more intense. The more blue, the less intense. And if you think about a storm radar, the more severe storm is red and the less severe storm is blue. So we think of it that way as well. And what you'll notice is she's hitting heavy on certain back teeth. But this is what I want you to pay attention to. Because when I rotate her bottom teeth upwards, this is the front of her bottom teeth. Not only is that contact red, that contact is actually on the front part of the tooth, which in dentistry we really don't want. We want these lower front teeth to be hitting right on the edge because that's how they're designed to hit. And we want those lower edges to hit somewhere in this capacity on her upper teeth. And little dots, not big broad contacts, not big broad bite force. We want little small light contacts, right? So what she's feeling is that these lower teeth almost feel trapped behind her upper teeth. So ideally for her, we would not just, if you look and we look at the scan, you can actually see how her teeth, let me see if I can do this. You can see how her teeth are leaned back. We want to straighten those teeth. But once we straighten those teeth, we can't just keep the upper teeth the way they are. we have to expand the upper teeth out a little bit to give those lower teeth some breathing room. So ideally we straighten the lower teeth and then we expand ever so slightly the upper teeth to create a better, more ideal bite relationship. And what I explained to her is I said, you might not notice that this is going to cause issues for you now because you're a young patient. But over time, what will happen is you'll start to have more teeth wear down. You'll start to have more chipping of the lower front teeth. You'll start to have more breaking of the teeth, more sensitivity, potentially headaches, potential bite problems. There's a cascade effect. It's a one thing builds on top of each other. So it's very important here that we can correct this, especially if we're thinking about doing veneers or bonding for you. So the first thing we would do in this case is get that ideal arch relationship like we're talking about. We would use Invisalign in this case for that. And then once the bite is ideal in that lower front area and the upper front area, then we can go ahead and do bonding or veneers, knowing that the bonding and veneers are going to be a lot better result. Okay, if we put cosmetic bonding on these front teeth and they have heavy contacts like these do, most likely that bonding is going to break down faster than if we had ideal bite relationships. Okay, so that is one very important part. I've done some videos on can we just fill it or fix it, and the reality is filling it or fixing it without fixing the bite first is always a recipe for failure. So for her treatment plan was very simple. First thing we do is align the teeth with Invisalign. Then we go ahead and whiten the teeth with a whitening because she was interested in cosmetic whitening. We whiten the teeth, and then at the very end, we actually give her what she first thought she wanted, which was cosmetic bonding. That is going to be a much better treatment plan for her and a long-lasting solution rather than simply adding some filling material on the front of her baby teeth and hoping for the best. So hopefully you guys got value from this video, and be sure to like, subscribe, ask questions on the bottom of this video if you have any questions regarding this, and I hope to see you in our office soon.